Hi everyone, Sam Lewis back again with our C Positive event for cancer patients and anybody else who wants to join us. who wants a little bit of information on our timetable that we're putting on. That many different things. I think we're getting people from all walks of life coming on, which is completely fine as long as we're helping you. So our next talk is by John Shelbourne. Now John Shelbourne is a friend of mine now. Over the years, he has helped out with Sam's Diamonds, doing rehabilitation fitness classes with us. And he's also helped out in hospitals doing their moving forward courses and things like that. I've got a nice little introduction for you here, John, so bear with me. If any of this is wrong, I apologise, okay? So John Shelbourne has been a fitness instructor and personal trainer for over 20 years. His background in personal training has included GP referrals, which has given him an understanding of a variety of conditions and illnesses. He is a specialist in cancer rehabilitation, which qualifies him to help patients who are undergoing treatment and recovering from cancer. Even though you have an illness, he can provide an exercise program tailored to your individual needs and ability. No matter what age or mobility, there is a form of exercise available for everyone. He believes that a personal trainer is not just for losing weight, it's about making a lifestyle changes for a better quality of life. So please welcome John Shelbourne.
Thank you.
Did you like that?
Yeah, brilliant. Gonna go home now.
It's a good intro. So do you want to tell people exactly what services you offer to cancer patients at the moment and where you're based, etc., etc.?
Right, I'm based in Western Point in Runcorn. I have my own studio. I also use toning tables as part of the rehabilitation. Now, with the rehabilitation, it's down to each individual's needs as to what each program is designed for. I really need to sort of speak to people on a one-to-one basis to get a full extension of what their needs are. That sounds a bit strange, but there's no one cap fits all. Depending on the procedure, on the mental capacity, the environment, there's all these things to take into account. So I can't just give people a program like a physiotherapist would. Do this for X amount of weeks. Each program is designed for each individual.
People have different lifestyles, don't they? And they have different body makeups. They have different experiences in the past that they've been through. So like different fitness levels. So you can't just go, here you go, here's a cure.
No,
can you?
Not at all. Not at all.
Oh,
only was that easy.
I know. So you do like a prescription, really, don't you? A prescription of fitness and well-being for your clients when they come in.
Yeah, as I said, it's purely down to each individual needs. The basis of each exercise program will be the same for everyone. It'll just vary in terms of the intensity, the capability of each person. I might change a few exercises, that sort of thing.
And you work with them closely and discuss it with them, see how they're feeling. And I remember that when we did the fitness sessions with the Diamonds, and you were on it. You were up to it on like, if you can't do that, try this, change it. And that's kind of a really good instructor to be able to adapt exercises to suit people's needs.
Yeah.
And that's something, because obviously I've got a fitness background as well. And there's so many instructors that stick with the same exercises for everyone. This will work, this will work, this will work. But they don't know how to differentiate with an exercise, how to make it lesser or how to make it more, and so on and so on, which is something I've seen you do and you're very skilled at, which is why you're on here, because I highly recommend you.
But primarily, Sam, it's about giving people confidence, because confidence wants to finish the procedures, wants to finish the hospitalization. It's all right saying do these exercises, but you've got to give the people confidence, to give them the confidence to know that they can carry them out. So it's all about confidence. It's not about regaining fitness. It's about regaining confidence and get yourself to a position where you can get yourself fit.
Well, this is something you said to me, and I thought, oh my God, you've got that spot on. People go, right, I've come out of cancer now. I need to get fit. I need to lose a bit of weight. But actually, you need to rehabilitate first before you can get fit. And that really made me go, oh yeah. Because you think, oh, I used to run 5K, I'll start running 5K again. But your body is not the body it used to be. So you need to rehabilitate back to that level first, don't you?
Yeah. The important thing is forget what you've done previously, because your body's changed now. I'm not saying you won't get back to where you were, but it's going to take a long time. So each day is a personal best. It's not just about doing personal best in exercise or activity or the gym. Your personal best is each day. Now, to some people, a personal best might just be going up a flight of stairs without puffing and panting. That's a marathon to some people. So it's about forgetting what you used to do and concentrating on what you can do. And further down the line, maybe things will pick up from where you were. But again, depends on the procedure and your mental capability.
Yeah, I think a lot of people struggle with that at the end of treatment as well, because they're like, right, I'm back. I'm going to go back to being that person.
No.
And the more they realize they can't, it can affect your mental health.
That's
but
right.
You can get there, but you're just not going to do it immediately.
Yeah, of course.
You just need to take
That's
your
right.
time and realize that. And I think as soon as people realize that, the easier it is to cope with. Because I mean, I'd say 80% of our ladies fall into a depression once they finish treatment.
Of course,
and that is because they're trying to be the person they were immediately.
Yeah, that's right.
But you have to take the steps to get there again and rebuild.
But given the majority of ladies that have a mastectomy, that's a big thing on a personal level. So that's a big mental step you've got to clear. Then you go down the confidence route, saying you're not on your own. There are other people gone through exactly the same thing. Where are you at now? I don't know. Right, let me help you. That's what I do. It's about building confidence, then giving them the suitable activity program. I don't like calling it exercise program all the time, because people assume exercise belongs in a gym, and it's not.
Yeah.
It could be the bottom of a flight of stairs. You know what I mean? It could be anything like that. So it's being active, not being exercise ready.
Yeah, it's like being off the couch, isn't it? That's the
first
of course,
step.
Being off the couch is the first step. Just while we're chatting, ladies, and if you've got any gents, if you have any questions for John, please put it in the chat as we go along, and we'll ask them all at the very end. And we'll put him on the grill.
Thought you were a friend.
So feel free to put your questions in there. I think that's the thing, isn't it? People see returning back to fitness, right? I've got to start walking, I've got to start running, I've got to start doing all the stuff that I used to do. But just having that mental ability to go, today I'm going to start. Today I'm going to get off the couch, I'm going to go outside.
But one of the main things is tiredness. The actual treatment wears people out, and luckily, touch wood, I've not gone through that on a personal level. My mum and dad went through it, so I've got a personal experience from that point of view, but not me as a person. And the tiredness is a big thing with people. They don't understand, or they don't realize the effect that the treatment has on them from a tired point of view.
One of the biggest things that is, because the fatigue, the way I sort of explain it to the girls is, when you come out of cancer treatment, you have a battery life.
That's right.
Now, if you have a day where you do a lot, you're going to lose all your battery life, and then it'll take you a couple of days to recharge. But if you can do little bits each day, then you'll keep that battery life. But we call it the boom or bust theory. So you literally go, I feel good today, I've got loads of energy, I'm going to do this. And then it's like the next day, nothing.
Yeah,
because you feel that energy and you go, I can do it. Doesn't mean you should.
No, exactly.
Just because you could doesn't mean you should. And that's one of the big sayings we say, so little bits and often will keep your energy levels like that. But just don't do what I did, because I did it. I think we all do it. Yes, I feel great today. I'm going to go for a long walk. I'm going to do this. I'll get the washing on. I'll do it. Every little bit just chips away at that battery. So
bite-sized chunks. Bite-sized chunks. That's the expression I use.
And that's why it's really good to have someone like yourself to be able to set that. Because if you've got a set amount that that you've been given, this is what you do today. Control yourself. This is what you do today. Then you're more likely to have success, aren't you?
Yeah, definitely. I said it's down to that confidence, Sam, as well. Once you get confidence in your own mind and your own body, then you can move on then.
Yeah. And it's also like, with the confidence side of things, if you are on your boom or bust thing and you keep going around like that, every time you do loads, you go, yeah, I've done loads, and then, oh, I can't do it today, I can't do it, why do I feel so bad? And then you get down on yourself, and it's like, oh my god, I'm so rubbish, you know, when am I going to have my energies levels? And you just sink, and then you finally get the energy back up again, and you do the same, and you just keep going. And
it's like it's like with that,
it's like
with any exercise program when you've gone through cancer or you just don't fit. You've got to have recovery periods. So you feel good one day, the next day you think, yeah, I feel great, I'll do it again. You can't do it. You've got to have your recovery days. Even professional athletes have recovery days, different standards, but they still have recovery days. And regardless of what condition you've got, whether it's cancer, whether you've got arthritis, you have any period away from being active, your muscles start going to pot. They just go really weak. So you have to build them up again. So it's an all-round thing, not just mental, as I said before. It's an all-round body thing. You've got to get your body conditioned to be able to move on.
And you've got these toning tables, which people look at them and go, what, you lie on a bed and it moves you, but you don't, do you? You lie on the bed and you put that bit of resistance against the bed that's moving you. Do you want to explain what those toning tables are?
Ultimately, a toning table, it's essentially what you call it, relaxed exercise. You just lie on the table and there's 3 areas which move, and those areas move for roughly 5 minutes each time. When you're in the gym, you don't do any set of exercises for 5 minutes unless it's on the treadmill, the bike, the row, a cross trainer. On the toning table, it's repetitive movements of the table against that particular muscle group, which gets the toning aspect. It's not about weight loss. So if you have a spine condition, the tables will work the muscles. I can't treat a condition, Sam. I have to work the area around it. So the toning tables will work the area around the condition to make that area strong. A good example would be someone with arthritis. Arthritis, by definition, is inflammation of the joint. It doesn't stop you moving the muscles above it, but they're the muscles that you've got to move to take the pressure off your joints. So by strengthening the muscles, it takes the pressure off working the muscles, it takes the pressure off the joints. So any muscle surrounding the affected area is going to be good, and that's what the toning tables do. So they work each area separately, but in each area there's 3 or 4 things that get brought into that exercise. So for argument's sake, the first one would be the shoulder muscles or upper back. Helps with your circulation and it helps with your posture. Now people just lying there, the posture will improve because your body's in a straight position. So it's strengthening the muscles without you realizing.
Yes, if I was lying in a straight position, which I never do, or when you sat, normally I'm slouched like this. So my muscles are conditioned to hold me in this position. Right. But if you asked me to sit straight and do all these exercises, I would find that really hard because I'm not used to it. So I'm engaging muscles now just by sitting straight. So by being on the toning tables, you're keeping me straight. And it could be something, am I right in saying it's something where it could be moving your arm up and down. This is really good for lymphedema as well. Moving your arm up and down like this, and you can press that resistance against it if you wanted to make it a little bit harder. But actually, the muscles are moving and doing what they're supposed to be doing without me actually trying to do it. So they're training to tone, aren't they? Is that right?
So that muscle you're moving there now, it's your front shoulder. It's also moving the joint. It's the joint that's moving, and the muscles attached to that is the shoulder, your upper back, and part of your chest. So as you said quite rightly, people with lymphedema, it's useful. Now, just on that point there, with the circulation, the heart pumps the blood round, but those with the lymphatic issue, that only moves around your body through movements, and the toning tables will help that as well. So it's not just a case of working the muscles, it's all the fluid in your body as well, use the best of expression.
All the other systems are getting the exercise from it, aren't they?
And I've actually had people, just going away from the cancer thing, I've had people who've had strokes, severe strokes, and the physio has been amazed at this is not me being a medical person, this is the feedback I'm getting from people who've used the tables. When physios have gone to work on the muscles which have been affected by the stroke, the muscles are being totally relaxed and loose. And when they've asked the patient where they've been, toning tables, carry on using them. And the same applies to people with cancer. The muscles have gone to waste, and the toning tables will help to build them up again. Now that's for people who are unable to be more physical. By that, go on a treadmill, on a bike or a rower, or do step up, that sort of thing. So there's always something. I work on the basis that there's always something that you can do.
Yeah, and it's like, if you look at the tone, I'm going to keep going back to them, but I just think they're amazing, because the only difference with the toning tables and you doing it is that your brain's not sending the signal to the muscle to move.
That's right. That's
it's
right.
Still moving. It's still getting trained. It's still doing what it's supposed to do, but your brain isn't sending it to tell it to do it.
That's right.
So it's toning up without the signal,
That's
basically,
right.
isn't it?
But over time, what happens is, as well, again, this is what I'm getting back off people. You've got to get that cognitive issue working as well, from the brain to the muscle. So the brain's got to tell the muscles to start working, especially with the likes of stroke and with different cancers, where the muscles have gone to waste. You've got to get the brain to tell the muscle to move, and that's the effect it's having.
Gotcha. That's really good. So if I was coming to you as a cancer patient rehab, and I was like, listen, John, I've been sat on my bum for a year, been recovering from cancer. I put loads of weight because these meds I'm on are putting loads of weight on me. I don't feel good. I'm just saying, this is me.
Yeah.
I don't feel good about myself. I've got restricted movement with this arm, and my back aches, my knees ache, and everything. I'm just shoot me. What would you say?
Right. Okay. Right. What size bullet would you want? No, it's a joking. I was first ascertain that you'd finished all your hospitalization and you've been given the okay from the consultants to start some exercise. Then I would go through the process of a one-to-one to find out more about you, what you've been through, where you're at now, what sort of procedures you've had. Then based on that, and your medication as well, because taking certain medications has a contraindication to exercise. So by definition, exercise as an instructor, you try and get your heart rate up, but there are people who are on medication to keep the heart rate low. So one's laughing at the other, really. So I need to have a list of your medication. Then, depending on what, as a result of that chat, I'll put together a program on the first visit based on what you're able to do. I won't just say, right, Sam, this is what you're going to do today. I'll suggest what we're going to do. And if you can do it, fine, I'll write it down. If you can't do it, I'll find an alternative. And that's the way it works with everyone.
So you start at something that we are able to do. We find out the baseline first.
Yes, yeah. More often than not, I start them on what they call a recumbent bike. It differs from an upright bike, where I have to be careful how I say this sometimes, because some ladies accuse me of saying they've got a big bum. But the seat's wider, and it's got a back support as well, so you're well supported there. And it's just a case of doing up to 5 minutes pedaling, low intensity, and then within that, I'll give them a target to look at on the clock, see how far they've gone in, say 5 minutes, and try another 5 minutes and see if they can double that time. But it's not double the distance, rather. It's not about how fast you can go, it's just completing that time. And it's 5 minute chunks. Then from there, we'll see if you do some upper body exercises, depending on what procedures you've had. I wouldn't give anybody who's had a mastectomy press ups to do. That's just not the right thing to do.
No, ouch.
So I would work. I'm being facetious there, but you would work around the muscles that you can use, okay, and just take it from there. Now, over time, if you've not done anything for 12 months, you've got a build up of scar tissue, presumably, if you've had nodes removed. So you wouldn't necessarily use weight, you'd use stretching methods to help. Yeah. So that's the process I would use. Find out where you were sort of post procedure, and then just give you little exercises to do to put a program together. Then we can just take it from there then.
Yeah, I think the main thing when we first come out of treatment is mobility, because we're all given exercises to do, but a lot of people don't do them. And I really, really swear, you don't do them, you don't do it, you lose it. Do you know what I mean? It's literally everything, especially with these exercises for mobility, for the armpit and everything like that.
Right,
If you don't
yeah.
do them and they do hurt at first and you think, oh my God, I'm going to snap something, but you
No.
won't.
No.
It does need to push through that.
Yeah.
And
you have to be careful as well, Sam, that you don't push through it, you work through it. I know it's only
no, the other way,
it amounts to the same thing, but with some people I can't do that. So it's just, again, I have to use the right expression. Not, not gym terminology, you know what I mean? So just to put people at rest, I don't ask you to push through it. We work through it.
That's just me. That's just me.
I know.
Work through it, girls.
That's the one.
So when you work through it, it allows you to, in the long run, be able to use your arm. I've got ladies who haven't done the exercises, and 3 years later they can't lift their arm any higher than that. It's too painful. Because it gets tighter and tighter and tighter the less you use it. So it's so important for them to do the exercises. And as you say, the first part of the training with you would be mobility and stretching, because you can't do anything with it until it is mobile and stretchy.
I use the analogy as well, that if you think of your muscles and your ligaments and tendons as a piece of plasticine or blue tack, if you wanted to stretch a piece of plasticine, you wouldn't just do it quickly, you would do it gradually. So you're going from a short to prolong it, and that works with muscles and ligaments and tendons. You've got to stretch them all gradually,
otherwise you snap them and it's very, very painful.
Of course. Yeah.
No, I agree. So do you have many cancer patients come your way?
I've got a few now, but over time, when I had to pack in the Delamere Centre, they got less and less, but word of mouth tends to be my best advert in regards to that. But I've probably got about 10 clients at the moment who've gone through the cancer procedure over a period of time, and they've kept with me. They're not so much clients as investors. They just they just keep paying me, which is fine. But I'm not a mercenary. But fortunately they won't trust anyone else, which is a big pat on my back. But really I don't do it for the pats on the back. Again, it's giving them confidence, Sam. And if I've given them confidence to keep coming to me and to be more active outside, that I'm doing my job.
Yeah, I mean, I'm not discrediting people in like personal trainers and gyms and stuff like that, because I used to be one myself. But if I was to go to a gym now and say, right, I've gone through cancer, I've done this, I've got this injury, I can't do this, I've had my lymph nodes removed, I've had this, I don't feel confident that they would know how to deal with that.
No,
I mean, I don't feel confident, because you can get a gym qualification when you're fresh out of school. You can go and do the course. You learn all about anatomy, physiology, how to use the weights, different exercises, and things like that. This is a specialized area.
Yeah.
And, you've trained in it, and we've got a couple of other people who have trained in it who we communicate with as well, who do like Pilates and things like that for cancer. And there's a reason why there's people who have this qualification and go that specialist route, is because it's a specialist circumstance.
That's right,
And it needs to be looked at by special. You can't just go to a normal gym or a normal instructor, because they're not trained in it, and they could actually make you worse rather than better.
I found that when somebody who's had cancer goes to the gym, the instructors don't want to know, because they haven't got that knowledge. I being old in the head would find out things first anyway. But they won't touch them, because a lot of the personal trainers now, they just see the glamour side of things and the big money, and it's not about that at all. The most important person is the client. And without that, I don't know, I can't understand why somebody who would get somebody who comes from cancer would not look further into it to keep that person as a client.
No, I agree. I do agree. And I think as well, it's like in the gyms, they are trying to stay with the latest trends. There's so many fitness fads come in and out. Like, you've got the HIIT training, and there was step and slide back in the day, there was step, there was all these different things, and that's what they're interested in doing, is offering the latest fad. But that's not necessarily right for the client.
No, it's not.
So it's knowing all the different things that you could possibly offer. I mean, what type of things do you have in your studio, so to speak, in your little gym?
Well, I've got a treadmill, I've got upright bike, I've got recumbent bike, I've got a rower, I've got kettlebells, I've got dumbbells, I've got everything that you would have in a gym, apart from static machines, which would be beneficial because you can be specific on a muscle group there. But with the type of person that I get on the rehab side, I just make use of what I've got. And again, it's down to the capability of that person, not what I think they should be doing. It's what they're capable of doing.
And that's a personal service, isn't it?
Of course, yeah. And that's the point of personal training. The clue's in the title. It's personal to you. It's not, it's not across the board. It's personal to you. But with some people, the title personal trainer is it's got this picture of army types and boot camps and in your face, and it's not. It's personal to you. At whatever level, it's personal to you. I mean, I've had professional footballers and singers and a gym. I've had a young gymnast, an international gymnast not so long ago. Their needs are different from someone else, but it's still personal to them. Just because somebody's able to do certain things, it doesn't necessarily mean they're capable of doing what everyone else is doing.
That's true. That's true.
Mm.
So if I was looking for a personal trainer or to get fit, have you got like any top tips for me to make sure of?
Yeah, it's not about getting fit, Sam. I said it's about getting your body conditioned to be able to move on. So for argument's sake, I always tell people, go for a walk 5 minutes away from home, turn around and come back. If you can do that, do it again. If you can do that, do it again, and then just add on a minute at a time. That way you're no more than 5-6 minutes away from home. Now, I've had, just as an example of that, I've got somebody who's got long COVID, and his GP told him to go on a walk, and he walked that far that he couldn't get back. So that's sort of, he wasn't given the right advice. So my advice would be to start off slowly, and just 5 minutes at a time. That's all. And unfortunately, repetition is the main thing. So I would give you I've actually got rehab at home programs for people who can't do exercise outside, and it's just the chair, doing basic exercises, using the chair as a tool, or as part of the exercise, or just for balance.
No, it's really good. We did a couple of those in our group because I did chair-based exercise as well. So obviously with lockdown we can't do our fitness sessions, so I've been going on videos on Sam's Diamonds and doing little exercises and trying to give alternatives and stuff. So I did a chair-based one as well, but every now and again they pop up, somebody's watching it, which is good.
Yeah, well, that's good, isn't it? What you want, isn't it?
Yeah,
what you want.
But I think doing little 5-minute stints so that you can get back is a big tip. What would you say would be the next step after that, so to speak?
If it was me, next step after that, I would go give them some home exercises to do, and I would even go to the home if the circumstances were changing from this the lockdown. It's doing stretching exercises and low intensity strength exercises as well. Just using tins of beans. I mean, everybody says tins of beans, but it can be any bit of resistance, really. But again, it has to be relevant to the condition and the ability to do these exercises. Because if somebody who's had a mastectomy, you wouldn't give them a lot of chest exercises to do. You'd work on the legs and the other parts first. And probably the chest would be one of the last areas that I would start to build up. I would strengthen the area around it first. So you'd have a program which includes strength, mobility, and cardiovascular, which is your walks.
Got you.
Then just build up from that.
Well, we've got your details in the chat. Has anybody got any questions for John? Just type them in the chat for us, and we can ask away. But you're based in Runcorn, aren't you? Do you go out to people as well?
I do, yeah. I go to people's houses. I used to do work on the fields as well, but obviously that's come to a halt at the minute. I say on the field, it's 1-to-1 on the field. It's not general field.
Sounded like you were cutting grass or something.
yeah, I'm not a farmer. But yeah, I go to people's houses, and what I'm that's why I put together the home rehab for people that can't come to me.
Yeah.
And it's essentially one of the other important parts of doing the rehab is that if somebody's got a carer or a neighbor or whatever, it's encouraging it. I show the carer how to do the exercises correctly to encourage the patients to continue with their exercises.
And of course, like all the exercise, whatever you can do, it always it helps to build up the body and strengthen the body, but that in turn helps to strengthen the mind and your mental well-being as well. I think the main thing is just get it started, isn't it?
Yeah,
just get it started, and that's the start of you feeling better as a whole, really.
Yeah. If you take away the last 12 months, I would say to someone, as soon as you finish your procedures, as soon as you finish your treatments and you got the all clear from the consultant, start your exercise then, start being active then. And it's just going on the walks and just building up from there.
And you do have to keep them small because your battery life, as I said before.
Of course, yeah.
Yeah, so you've got to try and find that right balance. Otherwise, you're going to be fit for nothing. And it is the smallest thing. I remember when I first finished treatment and I decided to go for like a mile walk with my husband.
Yeah.
And it absolutely wiped me out. And it was because he was walking at normal pace, but I couldn't walk at that pace. I was a lot slower. And I remember beating myself up over it, thinking, oh, for God's sake, look at the state here and all that. But then you have to turn it on the head and go glass half full and say, but at least I'm doing it. And it won't always be like this. And I will get myself back. And I'm back now. Do you know what I mean? But at the time, it's really hard mentally to get your head around.
I said it's down to confidence. Now, your background was fitness anyway before you went through all this. So you actually had a mentality about it anyway. So you fought your way through that. But there are some people that have never been in a gym, never done any exercise before. They're the ones that struggle with confidence. You've got to try and get that built up first, then start the movement.
I agree, but I do think as well it did make life a lot harder for me having a fitness background, because I had standards for my body and my fitness, and I was nowhere near that. So that did have an adverse effect on me as well. It's like I used to be able to do like 3 spin bike classes back to back in the day. Do you know what I mean? And now I can't even do the warm up in a spin. You know what I mean? And it was just like, deal with that one, Sam, in my face type of thing. So
but you learned from that though, didn't you?
And that's why I can talk like this now, because I've been there, done it, seen it, and thought, right, okay, solutions needed here. And it's actually just accepting the here and now and stop looking at the past.
Exactly.
To the future of where you're going to be. And it's a chance to start again and get a fresh start. Right, this is how my life's going to be from now on. This is what I want to see it as. This is what I'm going to work towards. Looking back isn't going to change squalid. I don't know. Diddly squat, squality dit. Nearly said.
Squadly dit. Squadly dit. That's a good one. That's so. What have you been drinking, love, at dinner time?
But he hasn't going to change anything looking back. Shut up, you two. She's laughing her head off. You're laughing your head off. I like squality dit. I'm keeping that. Squality dit. I like that.
We'll call that chemo brain.
It never goes. It never goes. It could be chemo brain. It could be menopause brain. It could be baby brain times 3, or it could just be Sam.
That's fair enough then. We'll take any one of them boxes.
Just blame them all. But it's like looking back isn't going to change anything. That's gone now.
No.
You know, and if you hold on to things in the past, it's only going to affect your future, and you're wasting a day looking back at what could have been, what should have been, what may have been, and all that, or what's happened. And while you're doing that, you're missing today. You know what I mean?
Yeah, what I found when I first started working for the Delamere Centre was that there was a definite generation thing. Some of the older ladies were reluctant to move on and try different things. The younger ones were more likely to do the exercise. Because you mention exercise to people, no, don't do gym. So I used to do a circuit training class, use of a better expression, And I used to put them to the test. I used to say, would you be interested in come to my circuit training classes at Halton Lodge? And they'd say, no, don't do gym. Okay, that's fine. So I'd talk a little bit more. Then I'd say, would you be interested in coming to my low intensity activity sessions at the community centre? Yeah, we'll go. It's the same thing. It's just the way you put it to people, isn't it?
Yeah.
So, and this is the confidence as well. You see, it's just trying to get. I always said as well, you put 20 people in a room and with the same condition, and they all think that they're the only one going through it. Yeah. It's only when they start talking to other people and they start opening up, they think, oh, hang on, there's not just me. And that's the best thing about what you do, about having support groups. It makes people feel better. Ultimately, it's not going to happen straight away.
Well, you've got your army, haven't you? You've got your army. And you don't even have to talk about it all the time. You just know that everybody around you is going through the same thing and they get it. They absolutely get it.
Yeah.
It does make a massive difference. It does make a massive difference.
Yeah. Confidence is massive.
Yeah. We'll get there with them all. We'll get there with them.
Of course we will. Of course we will. And as long as you understand, it's got to be step by step.
Yeah.
You can't take strides with this.
Yeah.
Yeah. You can't take strides with this.
No. And the slower you do it, the more sustainable it is, and the better results you're going to have as well.
Yeah.
So I think it's just accepting, this is me now. This is where I want to be. Let's take the small steps to get there.
Yeah.
And I think one of the biggest thing is, and this is probably, it does tie in with it a little bit. When you come out of cancer treatment and you are looking to the future, we all have this little baggage thing. I still have it on my shoulders. I don't know how long I've got, so I'm going to make the most out of every day, and I'm going to do this, and I'm going to live my life to the full. I'm going to, and every single day we try and do too much.
Yeah, of course,
God, not calling kettle right now. We try and do too much. We wear ourselves out, and then there's nothing left the next day, and then you get really frustrated at yourself because you haven't got any energy to do anything.
Yeah,
but it's because you've got this underlying thing that says, I've got to do as much as I can today and make the most out of my life while I've got one. And it's like taking control of that. Saying, Sam, nothing's going to happen to you for at least 3 months. You're well, everything's working. Yes, you've got aches and pains, but actually that's my body healing.
Of course.
So that's a good thing, and all these little aches, you start going, a headache more than 2 hours. Oh my God, that's it. I've got a tumor, and you've got to give yourself time to deal psychologically.
Yeah, of course.
Well, as physically, haven't you? It's a slow process, and you've just got to take your time and work with it because it's different for everyone.
Yeah. The important thing is don't try and play catch up.
Yeah.
Literally one step at a time.
Yeah.
One step at a time.
And you're going that way.
Yes. Yeah, definitely.
You're going that way. You're not looking that way anymore.
Yeah.
This is a new me. Let's see what this new me can do.
Yeah.
Do you know what I mean? Let's find out about her. Let's see what she can do now. And that's the only way I managed psychologically to get my head around things. And exercise was a massive thing in that, because as you said, that 5-minute walk turned into a 6-minute walk. And I came back thinking, I've achieved.
Yeah.
And it was 7 minutes. I've achieved. And I could see my progress.
Yeah.
And I could see me coming back. Whereas if you don't do your exercise, you just sit and thinking, worrying yourself, looking back at what was, and distract yourself. It gets frustration out, doesn't it? It's really good for your exercise. It gets frustration out of you as well.
Yeah. But it's all exercise part of the healing process anyway, physically, not just mentally.
Yeah, definitely. But it does help. It does help mentally as well.
Yeah.
Oh, do you know what? This has been amazing having a little chat with you. It's nice when people get what you're on about.
That's a catch up, isn't it? Yeah, I love this. I mean, I am nervous about it at the beginning, but I love it.
We just chat, don't we? We just chat.
It's some of them about. Yeah, it's some of them.
Everybody was listening then until I said a funny word.
Wiggly dots. That's a good one.